Hello madam and hello everyone, we are group 8 and today we will be presenting case study for chemotherapy management. Our group member are Christy Valerie, Elena Natalia, Muhammad Nur Ashraf and myself is Teresa Vera Shirley and my metric number is 2021. This session we will explain her treatment scheme, the pre-medication given, the dosage calculation for her chemotherapy, and the procedure used for preparation. Let's begin by looking at the patient profile in more detail.
Hi, my name is Christy Valerie and my metric number is 2027. This is a real example of a chemotherapy prescription from a hospital. The patient is 61 years old, she is female and has appendiceal cancer. Her treatment includes oxaliplatin and TS1. Before chemo, she gets pre-medication. This helps her body handle the chemo better and reduce side effect. Then, she gets the actual chemotherapy. First, they give her some fluids through IV to keep her hydrated. Then, she gets hydrocortisone to prevent allergic reaction. And after that, oxaliplatin over 3 hours, then more IV fluids. It's for a 61 years old woman who has appendiceal cancer. That cancer in the appendix, which is pretty rare. She's going through her 6th cycle of chemotherapy. The plan is called a 3-week regimen, which means she's got treatment every 3 weeks. The chemo drugs she getting the oxaliplatin and TS1, which is also called tegafluorouracil. This help kill cancer cells. Before the chemo start, she given a few other medication like granisetron, controlog, and some others. These are to help prevent side effects like nausea or allergic reaction. The chemo is given through an IV drip. One of them even takes 3 hours to finish.
Hi, my name is Muhammad Rashab Rahmat and today I'm going to present about pre-medication calculation. First, doctor prescribed IVB granisetron 3 mg for day 1. Available dose 1 mg per 1 ml ampule and 3 mg per 3 ml for vial. If used 1 mg per 1 ml, X equal 3 mg divide 1 mg per ml equal 3 ml means IVB 3 ampule total supply. If used 3 mg per 3 ml, X equal 3 mg divide by 3 mg per 3 ml equal 3 ml means IVB 1 ampule total supply. Next, IVB controlog pantoprazole 40 mg for day 1. Available dose 40 mg powder for reconstitution vial. X equal 40 mg divided by 40 mg. X equal IVB 1 vial total supply. After that, IVB Piriton, clopirniramine 10 mg for day 1. Available dose 10 mg per ml ampule 1 ml. X equal 10 mg divided by 10 mg per ml. X equal 1 ml means IVB 1 ampule total supply. IVB dexamethasone 8 mg for day 1. Available dose 4 mg per ml ampule. X equal 8 mg divided by 4 mg per ml. X equal 2 ml means total supply 2 ampule. Last, IVB Maxilon metoclopramide 10 mg for day 1, okay? Available dose 10 mg per 2 ml ampules. X equal 10 mg divided by 10 mg per 2 ml means X equal 2 ml. Total supply 1 ampule only.
Next, let's look at the table for pre-medication here. Before starting chemotherapy, the patient is given a combination of pre-medications to help prevent side effects. First, we have organization 3 milligrams given as an IV bolus on day 1. This is to prevent nausea and vomiting. Next is control 40 mg, also given by IV bolus on day 1, which is help protect against gastric irritation. Piriton 10 mg IV bolus on day 1 is used to prevent allergic reaction. Dexamethasone 8 mg IV bolus is given to reduce inflammation and prevent allergic response. And finally, Mexolan 10 mg IV bolus on day 1 is another medication to help control nausea.
And now I'm going to present about chemotherapy drug calculation. Oxaliplatin, patient BSA is 1.82 meter square. Dialin 5% dextrose for injection. Recommend dose is 85 mg per meter square. Available preparation 100 mg per 20 ml of oxaliplatin. Dosage calculation 85 mg per meter square equal x mg per 1.82 meter square. Quantity of drug to be injected 85 mg times 1.82 meter square equal x mg times meter square. X mg equal 85 mg times 1.82 meter square divide meter square. So x mg equal 154.7 mg of oxaliplatin. Volume required. Available oxaliplatin 100 mg per 20 ml. So prescribe 180 mg of oxaliplatin in 250 ml of dextrose 5%. 100 mg per 20 ml. 180 equals to what? So 180 mg times 20 ml divide 100 mg. So we get 36 ml will be diluted in 250 ml dextrose 5%.
Hi, my name is Ella Natalia and my metric number is 2029. Now, I will be presenting the procedure for chemotherapy drug preparation, which is a critical process to ensure both patient safety and effective treatment delivery. We begin by verifying the prescription. This includes checking the correct patient name, age, pre-medication drug, and chemotherapy drug, dose and schedule. Next, we put on personal protective equipment (PPE) and perform aseptic technique like perform hand hygiene to prevent contamination. After that, we prepare the clean area like use a biological safety cabinet (BSC) or laminar airflow hood in a designed clean area. Wipe all surface with appropriate disinfectant, for example like alcohol-based solution, before beginning. And gather all necessary equipment and supplies such as syringe, needle, IV bags. Wipe vial rubber stoppers and ampule necks with 70% isopropyl alcohol and allow them to dry. Wearing PPE before any handling to ensure safety and aseptic technique are maintained from the start. Chemotherapy drugs are toxic and hazardous. Even touching the outside of a vial or ampule without glove can expose you to risk. Then, We proceed to prepare the IV bolus with medications that will be administered 30 minutes before chemotherapy. This includes antiemetics and antihistamines to reduce side effects. For the chemotherapy drug, we withdraw 36 ml of oxaliplatin. This gives us the prescribed 180 mg dose. Then inject it into 250 ml of dextrose 5%, also known as D5W, and mix it gently without shaking. Once mixed, we label the IV bag with the patient's detail and include a cytotoxic drug handled with care warning label. If the patient is also receiving oral chemotherapy like TS1, we prepare that separately and ensure the patient understands how to take it. For administration, we give the pre-medications through the same IV line used for chemotherapy. Ideally, a central venous access device such as a PICC line, which is safer for repeat and long infusion. Then, we infuse 250 ml of D5W as per hydration over 30 minutes, followed by 100 mg of IV hydrocortisone. After that, we infuse oxaliplatin 180 mg in 250 ml D5W over 3 hours. Once the chemotherapy is complete, we flush the line with another 250 ml of D5W to ensure the drug is fully cleared. Finally, we observe the patient for at least 30 minutes for any adverse reaction, then dispose of all cytotoxic waste in dedicated bins and clean the whole area thoroughly. Okay, here the summary write-up. This case involved a 61-year-old female patient diagnosed with appendiceal cancer who is currently receiving her 6th cycle of oxaliplatin and TS1 chemotherapy. The treatment regimen follows a 3-week schedule, meaning she receives chemotherapy once every 3 weeks. She is clinically stable and has shown tolerance to previous cycles. Chemotherapy is administered via a central venous access device to ensure safety during repeated infusions. The chemotherapy preparation procedure begins with careful verification of the patient's identity, chemotherapy and pre-medication drugs doses, oxaliplatin 180 mg and schedule. Full personal protective equipment PPE including gown, glove, mask and face shield is worn before starting, and strict aseptic technique is maintained throughout to prevent contamination. The whole area is disinfected and all vials and ampoules are cleaned with alcohol wipes before use. Pre-medication such as granisterone, Raritan, Controlog, dexamethasone and Mexalon are prepared and administered 30 minutes prior to chemotherapy to minimize nausea and allergic reaction. Oxaliplatin is prepared by withdrawing 36 ml of which is 180 mg of oxaliplatin and dilute in 250 ml of dextrose 5% D5W. The IV bag is gently mixed, do not shake, and labeled with patient information and marked as cytotoxic. The procedure includes infusing 250 ml of D5W and pre-hydration over 30 minutes followed by IV hydrocortisone. Oxaliplatin is then infused over 3 hours. After that, chemotherapy, the line is flushed with another 250 ml and of D5W to ensure all the drug residues are cleared. The same IV lines is used for both medication and chemotherapy. The patient is observed for at least 30 minutes post-infusion for any adverse reaction. Finally, all cytotoxic waste is disposed of in proper bins and the work area is clean. This process ensures accurate, safe and effective chemotherapy drug delivery in line with best practice. That's all from us. Thank you.